Symptoms: gastroenteritis is most commonly caused by viruses. Gastroenteritis is most commonly caused by viruses, sometimes bacteria, and less often parasites. The signs and symptoms are generally similar regardless of the microbe causing the infection, and usually start within 1 to 3 days after you become infected. Diarrhea, which is when your stool becomes watery, and you need to go to the toilet frequently and urgently, is the most common symptom, and can range from mild to severe. It is not uncommon to experience one or more other symptoms, such as stomach cramps, vomiting, nausea, fever, chills, or headache. Viral infections usually get better within a week to 10 days, but some bacterial infections can cause severe abdominal pain that may last several weeks. Although often gastroenteritis presents as a sudden transient attack of diarrhea, if it persists it can lead to severe dehydration, which can become a medical emergency. Signs of dehydration include extreme thirst, not urinating throughout the course of the day or producing only a small volume of urine, dry lips and mouth, sunken cheeks, dizziness, floppiness, and loss of skin turgor, a measure of elasticity of the skin. Causes and risk factors of gastroenteritis. Many of the risk factors that increase the likelihood you will have gastroenteritis at one time or another are related to the transmission of disease-causing microbes, which spread through the oral-fecal route. Ingesting water or food contaminated with feces, person-to-person contact, or direct exposure to contaminated feces. Children are particularly vulnerable to gastroenteritis because of a lack of immunity. Risk is increased in the developing world, where transmission is increased due to poor hygiene, crowded living conditions, and poor nutrition. Although adults are less susceptible as a result of acquired immunity, the risk of gastroenteritis increases again as your immune system weakens. These include failing to breastfeed your baby up to 12 months of age provides the best protection. Using a baby bottle to feed your baby, these easily become contaminated as they are difficult to clean. Storing cooked food at room temperature for several hours before eating it, this allows the bacteria to multiply. Storing drinking water that could become contaminated before you drink it, or drinking water that is contaminated at source. Not washing your hands properly after using the washroom, or before preparing or handling food, and not disposing of feces hygienically, particularly baby diapers.